Hello, my name is Dr. Sherwin Su with High Mountain Orthopedics. In my opinion, one of the most exciting technologies is robotic-assisted surgery for joint replacement. This is known as MAKOplasty and actually uses a robotic arm to help guide the surgeon during surgery. Patients who undergo this procedure first have a CT scan of their hip or knee, which allows us to know the exact size of the joint implants to use during the procedure. Also, while performing the procedure, the robot assists us by placing the implants precisely in a more reliable manner. Whether this type of procedure leads to better results is unclear, but it does allow for greater consistency, which I feel is important for any surgeon. Another procedure that is becoming increasingly popular is partial knee replacement, and usually involves the medial or inner part of the knee. The advantages of partial knee replacement is that it is less invasive, allows for quicker recovery, and feels more natural because the undamaged areas of the knee joint and ligaments are preserved. However, not every patient is a candidate for partial knee replacement, as many people also have arthritis involving the outer part of the knee and underneath the kneecap. One of the disadvantages of partial knee replacement is that it typically does not last as long, because arthritis usually progresses to the other compartments of the knee. In younger patients, this means that they will likely need a conversion to total knee replacement at some point in the future. But in the properly selected patient, this is an excellent procedure and allows for greater range of motion and function. Anterior total hip replacement is another surgical approach that has received a lot of attention, especially in the past 5 years. Despite the name, it still occurs on the outer side of the thigh, but is an intermuscular approach, meaning that it goes between the muscles in order to access the joint. This approach can minimize damage to the muscle and tendons surrounding the hip, and it is a different approach than the posterior lateral approach, which has been the standard for more than 50 years. But despite the hype, recent studies have shown that there are no differences in recovery or function at 2 months, 6 months, and 1 year. So in the end, I don't think that you can say that it is a better approach. My advice to patients is that to choose a surgeon rather than to choose the approach. In the end, the most important factor is the proper placement of the surgical implants, which affects how long the total joint replacement will last.